40 minutes away from session. The Legislative Health Chair, Democrat Senator Therese Terlaje, and the Minority Leader, Republican Senator Telo Taitague. Good morning, ladies.
Morning, Chris and Sabrina and Jason.
Good morning.
Good morning, Chris, Sabrina, Jason, and Chris. Happy birthday to you.
Yeah, day. Nice. Thank you.
We haven't heard you sing in a long time, so
Yeah, Phil, you want to just sing your answers in this interview?
You know,
sing the budget.
The substitute budget bill.
We're going into special session.
Joseph Augustine wants to override the veto.
But we got appropriations.
Oh my goodness.
Jason hits the high note.
this is great. This is great. See,
Guard
I
your
love
glasses.
this yesterday.
Yeah. It's the budget, the musical. Sorry.
Yes.
Okay.
You got to do a musial.
You-
That's the latest thing.
You do a
You know,
musical.
an interview with all musical. People
Right.
have to sing their answers.
Not me.
Yeah. No, you're going to rap it, right? Senator?
Rap it. Chris will rap it. She'll rap well.
Okay, let's just get right into it. Serious hats now. I know you guys had saw the interview with Dr. Jolene Uggan. Count on Sabrina to throw that that big fastball down the middle. Ask her about the budget. And I guess just what did you guys unpack from that interview? We'll start with the health chair, Senator Terlaje.
Thanks. I want to thank Dr. Jolene. She's really, when they say front line, she's literally the front line at GMH for all COVID patients and especially those in the ICU. And so it's her expertise that our entire community is relying on. So I want to thank her for all the sacrifices she's making to be there all throughout this emergency that we are having. And it looks like it's going to be for a while. So I want to thank her. As to the budget of GMH, I just want to tell you, when they talk about CIP, it's very interesting. Everyone in the community will agree, GMH needs money to fix their facilities, but GMH does not request CIP funds. When they made their budget request, when the governor sent down her budget request, she does not request for CIP funds to be given to GMH. It's only the legislature that has insisted that $10 million be given to GMH for CIP. And this has been going on for a while now, and we want that money to go to GMH regardless of, I don't know what's impeding that, right? But so we've again put that into the budget, and we expect that money to be delivered. I think it's a shame that the facilities were not, at least the roof was not fixed before we got into this crisis. That's bad on all of us, but I'm telling you, it's we can't. Now we're in the middle of it, so we are dealing with it. But I'm telling you, it's one of those things that I think it's a matter of priorities. We've got to prioritize and not delay. Already, the Army Corps told us don't delay on these facilities improvements because that's a matter of healthcare. It's a matter of how if the nurses are going to be running around floors that are dripping versus direct patient care. That's what we're talking about. So. I think that the GMH's overall budget in this year is very similar to FY20. So they did not get a huge cut. I mean, they didn't get a cut from FY20. Of course, they didn't get everything that they requested. And so there's still work to do. But they're doing much better than public health, I have to say, in terms of cuts. Public health's the one facing a big cut right now.
Senator Telo?
Yeah, thank you. And again, I'd like to resonate the same kudos to Dr. Uggan and all the people down at Guam Memorial Hospital. The hospital for the longest time has had issues, and that was one of the first things I wanted to champion when I got into the legislature, and that was Bill 5, which created the task force. And, it took forever to try and get this bill through. And in fact, it was on session, and then someone voted to go back to committee and then tried to get back up again because we know what's happening at the hospital. It's plain as day. I don't think we even needed the Army Corps of Engineers to come in and tell us, that there's an issue with the hospital, and that a Band-Aid effect has been going on for the last 15 years in this Band-Aid effect. We needed to move forward. This task force would have also found some additional funding and set aside. I mean, we built how many schools, high schools, and had that project going on with funding, where they spend the funding upfront, the contractor, and then it's lease to own. I mean, that's the same probability we would have with the hospital. So I just wanted to, reiterate also that the hospital, the budget, we were very careful at that, but knowingly that the governor had all this COVID funding that was coming in. We know that she can take some of that COVID funding and CARES Act funding and use for the hospital. That was one thing we were hoping and guaranteed that she would do. But, the task force is not up and running, but the bill passed. And yet, the speaker hasn't implemented this. Gita was part of this, and we're still waiting for them to appoint these individuals to the task force now that is passed. So I think that we're going to do everything we can with the hospital. I'm kind of worried. I'm very worried. Section 30 money is a big issue. We didn't get as much as what we anticipated. So a lot of times we use Section 30 money for the hospital. So I'm just hoping and praying that that any additional funding we get from the federal government goes directly to the hospital.
I think we got the CARES Act money, the 117 million in April, correct? Right? Has any of it, are you guys aware if any of that money went to GMH?
I think some of it has, but GMH has also received their own direct federal funds for improvements at the hospital because of COVID. So they've got some things to do up there.
So you guys are about to go into session at the top of the hour. You guys got the substitute bill that the governor sent over. What can you tell us are the major differences, or do you guys plan on voting for an override?
Okay, I guess I'm a lot short-winded than you are, Therese, so I'll just get it through. Okay, well, we looked at the bill over the weekend. I noticed there was a lot of flaws there, language that was put in there that actually did not give an appropriation instead of an allocation, which is quite surprising. And I also noticed that it was unbalanced, with her budget that came in. So I'm a little bit concerned. You're taking money away from GCC. That's concerning, though I've been an advocate for the judicial branch for quite some time. And I think that we can find a way to assist the judicial branch, in the coming months, as we can kind of get a little bit more grip on where we are financially and provide that assistance that they need for the judicial branch. So it's going to be quite interesting when we go in there, but I think that the bill that we passed as a legislature, the 13 of us that passed, is a much better bill than hers.
Senator Therese?
Period.
Yeah, sure. Well, I don't know. After we received the veto from the governor, I reviewed it quickly and I sent a letter to the speaker asking her to call us into a regular session so that we can consider an override. We can't do that during the special session. We can only consider what the governor's called us in for. So that's what we're going to look at this morning, the governor's bill. I think, everyone agrees. Public health should get more money. We all agree. That's not this dispute. The dispute is, do we increase revenues or projections of what we're going to be receiving in the next fiscal year in order to do that? Or do we prioritize among the existing appropriations in order to do that? So I've tried to do both. And I don't agree with increasing the revenue. I say, yes, public health needs more, and there are other ways to give them more, including, cutting from things we don't need and putting that to public health. But I don't believe that the economy is going to be as robust as it was during FY19, or the corporation income during FY19 is going to be the same for for 2020. So I don't believe that is reliable. And if it is, we have provision in this bill, the one that we passed, that says if we do receive revenue over what we are projecting, then by all means, let's move it to where we need to move it. And I'm, of course, advocating that it all gets moved to public health at this point. But luckily for public health, they've got some federal funds that they're able to use to take care of the COVID matters, especially the tracing. And that's really, for me, the priority We need to get that tracing capacity in by whatever means possible, by federal funds, by use of the CARES money or the COVID, the 117 million that the governor has. So luckily, public health, at my urging, and I was really kind of hard on the former director, saying, why did you guys not request anything of this 117 for your tracing? Let's get that up to speed. You're waiting for this other federal money. We don't know when you're going to get that implemented. And she did. So, but we only found out a couple of days ago, last week, that the 3 million additional supplemental request from that 117 was finally approved. So now they have to implement it. And, so you've heard their plans. They're expanding their tracing and testing, but I really believe that is the key to opening up our economy safely. If we can't get a handle on that and we can't be stellar in that capacity, we're going to continue to fail, and we're going to continue to lock down indiscriminately, and I want that to be based on data only. It has to be as narrow as possible, as fine-tuned as possible. And that's why I've also pushed them I told them, I can't see why all of your data is not public. If that's, except for names, of course, we don't need to know their name, but we need the data. And I can't understand how decisions can be made without that data. Like, why are we closing bars if we can't see the data that says bars are the issue, or funerals, right? And so we hear that kind of from here or there, but we don't hear it formally. And so that's what I pushed them. And so I told them, if you're not prohibited, then you should be releasing the data. So they finally, at my urging, went and got a legal opinion that tells them what they can and cannot release. So I'm hoping, they said that they're going to start this week with a weekly release of increased data. And so I'm hoping that all our actions from here on are based on more facts.
I sense
Wow.
So
You need to get an opinion on data in the middle of a crisis to figure out what the hell we're going to do. That's just great.
Well, the other thing is they were doing it differently for different occasions, right? And you guys have pointed this out many times. So, and I said, that just does not seem right. And it looks so political, and the businesses, of course, it sounds unfair to them, because you need to have a policy that can be applied across the board and applied fairly. And that's what.
And that's one of the issues. I think that you hit it on the nail, is the fact that businesses are being closed, and you have the banks that are open. What's the difference, between them? And it was not clear whether if someone was contacted with COVID in that business, they were shut down one day, and then they were allowed to open the next day. While other businesses, it would take them 14 days. They had to wait 14 days to come in. So it's just not clear to a lot of these businesses. They're very frustrated out there. They're implementing their safety precautions. And public health is mentioning they've had people going out and inspecting all these areas to ensure that they're following the guidelines of public health. And they're doing that. So why are they still maintaining that they have to shut down, but yet Bank of Guam and all the other banks, can open up? It's just not fair. And it's not accurate with that data showing any reason why. Example, the quarantine facility. Why is this individual not able to go home and quarantine, but yet another person is allowed to? There are no guidelines. And I'm glad the courts came out finally to recognize this issue.
Well, there was a point that was made. You can test positive and you can go on home quarantine, but you can come into Guam and you're straight to quarantine for 14 days. And even have a negative test. Anyway.
Yeah, and at least, if you're going to do these guidelines, don't switch it the next day or make it up as you go. Set a plan in place. And that was one of my biggest concerns, while we were having this public hearing with public health. And I'm glad to hear that they're opening up a new agency in public health, to address it. And it's an agency that's going to stay there. It's not like just until COVID is here. They're planning on having that, but the problem is it's not going to open for another 6 months, and we need the assistance now.
Right. I see it when you talk about data driven, and it's just uneven, the application, and even just something as simple as what's essential and what's non-essential. We just had a lot of talk over the weekend about, and I'm just saying this for a friend, not being able to buy like birthday cards or balloons, but then you can go buy other things that are probably less essential. So it just doesn't really, and I don't know who came up with these guidelines, but it's like someone's telling me they couldn't even buy a pair of Zori.
Right. Well, what I'm hoping we're going to see is a more narrow definition of what is the high risk, right? Is it really buying the Zori that's high risk, or is it getting together in groups? And so, from what public health said during the hearing, that really does seem to be the risky behavior. It's that grouping. So if an establishment cannot prevent the groups, then those are the ones that, either need to change how they operate or need to close.
Yeah.
Right?
Yeah.
Plain and simple. And so I'm hoping that public health just gets that very clear right now. It's like you either prevent the grouping or you can't. We're not going to be able to function.
It's just it's frustrating, I think, for these business owners, because when you say like that, right? So it's the groupings. And so we have a lot of these small businesses that they don't have the floor plan, or they don't have the plan even to be able to conduct business while adhering to the 6 feet, adhering to the, occupancy. And I mean, we saw it when they opened them up 50%. It's like that wasn't good enough. And now the call from the businesses is let us open all the way. But do you think that could be done safely if grouping is the main concern about the transmission of the virus?
Wait, no, I thought the main concern, according to the PAG, was people visiting family members,
Right.
or even having large, barbecues and things like that.
Gatherings,
It
right.
wasn't necessarily like.
That's a similar result. It's the grouping. They're getting together. They don't live together, and they're getting together, and they're getting close enough for long enough to spread the virus. So that's really it. So we have to prevent that. If barbecues do that, then we prevent barbecues, right? Yeah.
I'm just saying is these businesses are regulated.
Right.
You have the Division of Environmental Health going out there and doing their inspections. And, I hear how you guys are saying, well, we're not getting the data. Like, is it the bars? No, maybe it's not the bars. But we hear the PAG saying, people are getting it from family members. They're getting it within households. They're getting it from people that are visiting people that are within their households.
Yeah.
Right. Yeah.
So just kind of like, okay, so where's it all coming from?
No, they're both the same.
both, right.
And in my mind, it's yes, that's why it's high risk, because you're bringing families that don't live, are not bubbled together, and that's what you have to prevent. You have to prevent.
There's no regulation, and there's no regulations. You're absolutely right, Sabrina. We've been regulating the bars, we've been regulating the restaurants and all the other businesses, and making sure they're safe, but we can't do it with family members.
Yeah.
And as to the regulation, if I could just put I want to commend public health. They've worked all weekend to go and try to inspect these construction companies, whether they're complying with what the rules already say they're supposed to be doing. They're supposed to be quarantining, they're supposed to be having their own medical experts in there. All of those current rules, public health's going out on top of all of their other work to go and, enforce right now, make sure that those construction companies can get back to work. They worked all weekend, I understand. And so, I think they're doing the best. And that's one of the reasons why I really demanded during that an oversight hearing, even in May, that why aren't you getting more people in your Division of Environmental Health?
Right.
That's the division that does the inspections, that does help with the guidelines to, review all those business plans and the inspections. Because if it's just a matter of one bar's not following the rules, let's shut that one down, right? But so they have, and so I'm very glad to finally hear that they've been approved for that additional $3 million from the 117, and that they're going to get more inspectors on board and more help in the environmental health division also.
Right. Yeah, we had them on last week, and it definitely sounds like they got their stuff together.
Yes. Tom Nadeau, he's great. He's thorough, and I think he's fair. So they're working very hard.
Yeah, according to Arts and Augustine, you can't. to pass mustard, it's very difficult with Tom.
Right.
So I'm confident he's been there for so long and he knows exactly what he's doing. So I greatly appreciate all the hard work that they're doing. And I'm just encouraging them to continue using this funding and not letting any funding lapse. That's important. You know, a lot of times public health has had some funding lapse. But I appreciate all the work that, especially the new director, hopefully the new director, we're going to try and confirm him, Arts and Augustine. He's got a wealth of knowledge, and I hope he makes some great changes there that'll assist the department.
Let's touch on this quarantine issue. We just had the Jeannie Gross and his attorney, Rachel Azuzu, on. There's a class action suit pending. I remember going back to late March, Linda Umpinko Denorsi had to cancel an interview with us because she said, Chris, I got to go into court. And I got to go into court because I got to do this thing so that our quarantine can stand up and we won't get sued and they won't shut it down. Well, that was Miss Linda. So, and I asked Rachel again, like, that's what she did. What changed? I mean, what changes? I guess they never did it again. So, in your opinion, I know you're an attorney. Does this mean the end of government quarantine facilities for returning residents?
Oh, not at all. I don't think so. I think what the court's saying is they need to do what they did before, and that is give everybody notice, let them know you're either voluntary to go into quarantine or you're going there involuntarily. We can only do this for a certain number of days. You have the right to counsel. You have the right to go to court and ask to be, removed from quarantine. You have those rights. And so they have to, it's that communication. They have to communicate that effectively to anyone they're putting into quarantine. So I think that courts made that very clear. And you're right, Linda did that. And so it's a challenge. I'm telling you, we've had public health directors switch entirely in the middle of an health emergency where the public health director is the health authority. Mind-boggling, really. And it's a challenge all the way around. I'm sure of it. Even you can see the division heads, they have to shift also for the new directors, how we're going to do things now. So everything changes very quickly, very difficult all the way around, I think. But no, they just have to get their act together in that regard, and they've got to get that communication crystal clear and legal.
When you guys go.
Go ahead, Sabina. Sorry.
I was just going to ask, when you guys go in at 10 o'clock for session, should we expect the governor's financial people to be there? Or we're going to have to go into recess and then come back after lunch and then give them time to... you know how it goes. It's
it's so tedious. I'm just tired of it.
This is why you have to watch.
Yeah.
You never know what's going to happen. I can have all these plans, left and right, but you never know. But I just wanted to mention, as far as what public health is doing, I think like I said earlier, it's important if you're going to create these guidelines for individuals coming into Guam and those staying at the quarantine, they have to be guidelines to follow. And the problem with this whole issue was this family did follow the guidelines, and then they were told something different, and that's where the problem, lies. And I just hope they're more firm on their rules and regs, and everything should be posted on their website too as well. So,
right.
And it is getting close, so
right.
Got to drive.
I know. So we're gonna just a couple more questions. We had Senator San Augustine on, and he said again that he was going to pursue an override. But Senator Terlaje, is that even possible under the rules of the special session, or?
No, we can't do it during this special session, which is why I wrote that letter urging the speaker to call us to another session. So we have the option. Otherwise, I don't want to have to wait, forever, and then I don't know what will happen.
So it kind of seems like you guys are handcuffed by what the type of session the speaker called.
Not technically not.
We need a session. Yeah,
Right,
that's
right.
that's for sure.
Yeah, that's required by law.
So Senator San
Yeah.
Augustine just doesn't know the difference between an.
No, you do.
No,
How
I
many
just
hour
think in general,
notice?
you either, we have three options, right?
Right.
We're either going to support the governor's new bill, vote that in today without either with or without the professionals from BBMR and DOA coming down to talk to us about it, and we just adopt new revenues like that. I don't know, right? Or we vote it down, go into another session, and we consider whether we're going to override or not. Or we go into a whole new bill. We start all over again. And I think we can work with the current bill that was vetoed, and that we can overcome any of the issues that we can make corrections. We can, the governor can transfer $27 million if necessary. We can deal with new revenues as we see them and appropriate that where necessary. And we can do all of that with a much lower risk.
Yeah, there is one other option other than the, deal with it with or without them, vote it down, and then closed session go in. But there is another option to send the bill back to committee, send it to committee, and then, go from there. But that's going to be long and drawn out. And, at the end of the month, we have to pass a budget. If we don't, then the current budget will roll over. And we know that budget is almost $60 million more than what we projected for 2021. So that's another option that was there. But there's so many options, but where I'm definitely going to go in there and fight for what's best for our island, and not give any false hopes by projecting higher revenues that would make these departments and agencies think they can start spending, much more than they're going to get.
Right,
and that's the worst thing that we can put ourselves in. So,
and if I could just add one more thing. So, we've cut $64 million from what we are spending today. And you see how we're scrambling today, some of these agencies, we're cutting $64 million from that because of decreased revenues. So it's going to be hard all the way around. I mean, that's why I'm saying it's good we were able to keep GMH at the same level and that we didn't have to cut them, because we've had to cut almost every other agency. And that's a huge, but it just we might have to do more. We might have to do more. It depends, what really happens with the economy. And so that's why our economy depends on large part on public health's ability to trace, investigate, and we need to make sure they can do that. And I think if everybody works together using federal funds and local funds, we can do that. We can maximize our Medicaid. We can do all of those things, and we just need to do those and get to it.
I just got to ask.
We also need to assist to help the businesses get back on track. Bringing our economy back is just as important. We're hurting.
Right.
Guam is hurting. 30,000 people out of a job right now, and we got to do everything we can to assist them. And it's not just providing those who are out of a job, but providing assistance to businesses. Giving them breaks, and that's what we need to look at too.
Right, and I know
it's a balance act.
Right. And the PAG is going to be looking at this issue too. They've been told to come up with a list of types of businesses that they believe they can open, and they're going to be discussing that tomorrow night. So it's definitely a conversation that's right on the front burner. I just wanted to close by asking about these Gura raises, because I know Ray is a big buddy of yours, Senator Telo. The board, don't choke. And I don't know, Senator Therese, we'll just start with you. Optics wise, go ahead.
I'm glad you brought that up, because, man, when I saw that article, I was very upset. It's that's saying it nicely. It's honestly, I just can't understand it. Here we are. Yeah, we're arguing about public health, money, and give me a break. We're gonna give people raises in the middle of this thing. People who are already making over $100,000. I can't. I have no patience for that kind of stuff. I just don't see it to be necessary in the government. I not now, not ever.
But
it's federal funding.
But it's the federal. It's under the federal.
No, but this is federal funding that can go actually to those individuals who really need it at Gura, who seek assistance for federal funding. This money can go directly to them. It doesn't need to go to the director, who is already the highest paid director on island right now, by giving him, or the deputy. I really didn't want to say anything because, people will look at me, oh, well, because he did this and that. No, it has nothing to do with that. I asked a simple question for board director, and later on found out, okay, this is a good friend of his that was nominated as a board. Okay, well, who gave the raises? Put two and two together. You know, I mean, you
Yeah.
stack your board with yes people, and it doesn't. This is very. It smells very bad.
Really?
You know, I'm not taking away from the employees at Gura at all. Not they have been doing a great job. I have a very good friend who's been working at Gura for a long time, and they do an excellent job. But this money can actually go to the programs that they offer at Gura, not to a director who already gets this money or a deputy director who gets this much money. And during a time like this, you know, ditto to everything that Senator Terlaje said. You know, it's just. But I was going to stay quiet and just say.
Come on.
Very
You know I'm
bad,
not going to
but-
let that happen.
No, you know what? You know what, Chris and Sabrina? It's the message that we send to the people of Guam. What is our message? You know, what is our message? That we are trying our best to help them? Or, you know, is that our message? Because that's where we lose everyone. We just lose them because they can't trust us to stay focused on them. You know, stay focused on the people who are suffering. Stay focused. Let's not get distracted by pay raises and all other kinds of things that are not necessary right now. And that's how I tried to look at this 21 budget. Is it really necessary right now? It's a beautiful program. It's a great thing to do. But is it necessary right now in 2021 while we're facing a health emergency, while we've got nurses scrambling for our lives? Is it necessary right now? That's the most important thing to focus on. And we need to stay focused. The whole entire government, not just one part of it, all of it has to stay focused on message and on delivery.
Well, I guess I won't ask about the traveling nurses then. You do know it's 107. They're looking at contracting that out, Senator Therese.
Yes.
The traveling
Yeah,
nurses.
it's going to be expensive. It's a very expensive way to get nurses, but unfortunately, yeah, that's our situation.
Yeah.
Right.
All right.
Well, thank you guys. Go get them in session. Like Senator Telo said, tune in. You never know what you're going to get.
Yep. We'll be recess. Come back lunch. Maybe not. Have
Is it a Zoomy session?
I'm just kidding.
Feel free anytime to reach out to us, even on the recess, to find out what's going on.
Yeah.
You know, I want to be very transparent what's going on in the legislature.
Is
So
it,
thank
are
you
you-
so much.
Are you guys back on the session floor or is it still Zoom? Sorry for my ignorance.
It has to be.
On the
It's
floor.
on the
On the
floor.
floor for
Okay.
the special session.
Okay.
call. Yeah.
Okay. Well, good
All right,
luck.
take care, you guys. Thank you so much for
All
all
right.
you do.
Right
Thank
on.
you.
Hug 'em
Take care.
off. Thank you.
Everybody.
There you go.
Thank you, Jason, too. Okay.
There you go. Bipartisanship. I love it, especially in the morning. Minority Leader Senator Telo Taitague and Legislative Health Chair Senator Therese Terlaje. Well, I guess they didn't like them raises.
Whew.
We gotta ask our buddy Ray to come on tomorrow.
Oh yeah, probably.
Okay, 9:51. We'll take a break and we'll do a little catch up with the crank Frank Camacho, who of course, man, crazy week for Guam and the UFC. So we'll talk about that coming up.